When using the Systane Ultra Dropperette, single-use dropper, it's important to follow the directions on the product package. If you have any questions, consult your doctor or pharmacist. Do not use the solution if it has changed color or is cloudy, but some brands may have a milky appearance, which is okay as long as the solution does not change color. Some eye drops need to be shaken before use, so be sure to check the label. You can use the drops as often as needed, while ointments are usually used 1 to 2 times daily as necessary. If using an ointment once a day, it may be best to use it at bedtime. When applying eye ointment or drops, always wash your hands first and be careful not to touch the dropper or top of the ointment tube to avoid contamination. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. Place the dropper directly over the eye and squeeze out 1 or 2 drops as needed, then look down and gently close your eye for 1 or 2 minutes. For ointments, hold the tube directly over the eye and gently squeeze a small strip into the pouch, then close the eye and slowly roll your eye in all directions to spread the medication. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications, and use eye drops before eye ointments to allow the eye drops to enter the eye. If you wear contact lenses, remove them before using most kinds of eye lubricants and ask your doctor or pharmacist when you may replace your contact lenses. Finally, tell your doctor if your condition lasts or gets worse after 3 days. When you first start using Systane Ultra Dropperette, single-use dropper, you may experience temporary blurriness in your vision. You might also feel a slight burning or stinging sensation, but these effects should only be temporary. If they persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has recommended this medication, it's because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you notice any serious side effects such as eye pain, changes in vision, or persistent redness and irritation, it's essential to inform your doctor immediately. While rare, a severe allergic reaction to this medication is possible. Seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not mentioned here, be sure to reach out to your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA, and in Canada, you can report them to Health Canada. Always consult your doctor for medical advice about side effects. Before using Systane Ultra Dropperette, single-use dropper, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. If you have any health problems, it's important to consult your doctor or pharmacist before using this product. After applying this product, your vision may become temporarily blurred. It's important to avoid driving, using machinery, or doing any activity that requires clear vision until you can do so safely. When using Systane Ultra Dropperette, single-use dropper, it's important to be aware of potential drug interactions. This means that the way your other medications work could be affected, or you may be at a higher risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without first seeking your doctor's approval. This will help ensure the safe and effective use of Systane Ultra Dropperette, single-use dropper. If accidentally swallowed, Systane Ultra Dropperette, single-use dropper may be harmful and cause serious symptoms. If someone has overdosed and experiences passing out or trouble breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Always use caution and keep this medication out of reach of children. When using Systane Ultra Dropperette, single-use dropper, it's important to be aware that some products may contain preservatives that could potentially harm contact lenses or cause irritation for people with allergies. It's always best to check the product package for more information or speak with your healthcare professional if you have any concerns about using this medication. This medication is typically used as required. When using the Systane Ultra Dropperette, single-use dropper, it is important to follow the storage instructions on the package. Always protect the ointments from freezing. If your drops come in single-use vials or droppers and are preservative-free, make sure to discard them either immediately after use or within 12 hours of opening. Check the product package for specific instructions on when to discard the preservative-free product. If you have any concerns about storage, be sure to ask your pharmacist for guidance. It is crucial to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.